Gibson and Kohli coming to you with Snackable Health, and we're talking about Paxlovid rebound. Our CDC Director this week, Dr. Walensky, let us know that she had a rebound effect after taking the Paxlovid. Paul, what are we learning about this?
So Paxlovid, as you know, Mike, is an antiviral for COVID. So after you get infected with the SARS-CoV-2 virus, which causes COVID, you want to start this within about 5 days of symptom onset. And the idea here is to suppress viral replication, prevent the virus from making copies of itself, which can then prevent all the other immune responses and the collateral damage that occurs. So, the way that the medication was studied was for a 5 day course of the medication. What many scientists are saying is that perhaps it ought to have been longer because we're seeing a lot of people after those 5 days, they test negative, and then a few days later, the virus kind of wakes up again and starts making copies of itself again, and they start to turn positive again. And that's called Paxlovid rebound. Now, the good news there is that the second time around generally tends to be asymptomatic, no symptoms at all, or milder. Very rarely can it be worse the second time around. But it does beg the question of whether the initial course should just end up being a lot longer. And it also begs the question of how common is this? Because at this point, we've had, the president, the first lady, and Rochelle Walensky all have Paxlovid rebound, as well as Dr. Fauci. So the numbers that we hear coming out of the White House of a 5% incidence of Paxlovid rebound appears to be an underestimate, where we actually think that it might be significantly higher for people that are testing on a regular basis.
Why was the 5 days chosen initially? Do we know? I mean, why not go 10 days? I mean, why did we pick five?
Yeah, that's a great question. I think it's based on the viral replication phase. So, how long the virus's life cycle kind of lasts and how long the symptoms last. And I would also add that early in the pandemic, when we wanted to get a lot of this data, we were picking shorter time courses to study medications because we wanted results sort of faster. So, a lot of people, including Dr. Fauci, are advocating for the fact that perhaps it should have been a 10-day course because the incubation period of the virus, or how long it can kind of stay inside your body, can be up to 14 days. That's changed a little bit with the new variants, but still around that same kind of 10 days to 2 weeks mark. So perhaps we should have just gotten a longer course to begin with. And Dr. Fauci actually ended up treating himself with a second round of Paxlovid after he had the rebound. So I almost think it's a little bit of a mislabel. Instead of calling it Paxlovid rebound, I think we should call it persistent virus, because the virus kind of goes away, but it doesn't completely go away with those 5 days, and it kind of wakes up again. My bigger concern, to be honest, in the future is, what does this mean for the effectiveness of Paxlovid? Because if we're incompletely treating so many people out there where they still have virus in their system when we stop the Paxlovid, are we going to start putting pressure on the virus to evolve in a way that the Paxlovid stops being as effective as it is now?
Or could we perversely increase the duration of the time where someone is infectious? I mean, I don't know. These are questions that need to be sorted out. Well, thanks for the update. Paxlovid persistence is the new Paxlovid rebound, I guess. So thanks, Payal. And thanks to all of you for joining us here from Snackable Health.